Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition.
Hello, and welcome to Health Matters, an educational series from the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Afam, and today we'll discuss training on bloodborne pathogens, or BBPs for short. Now, I know this topic might sound a bit heavy, but it's something that keeps us all safe. You, the healthcare team, and everyone inside the facility. Correctional facilities are what we like to call high-risk settings, meaning diseases can spread quickly if we're not careful. As porters, you're often on the front lines cleaning up spills, handling laundry, and taking out biohazard waste. That means you might come into contact with bodily fluids that can carry the risk of infection, such as blood. Through this training, you will learn essential safe practices, discover how to avoid critical errors, and gain the knowledge to protect yourself daily from potential exposures to bloodborne pathogens. Let's talk about what we actually mean by bloodborne pathogens. Basically, they're tiny germs that live in our blood or certain bodily fluids. You can't see them, but they can cause serious illnesses if they get into your body. While there are a multitude of BBPs, the main ones we worry about are hepatitis B, hepatitis C, and HIV. Here's what's important to know. Hepatitis B affects the liver and spreads easily through blood or bodily fluids, including dried blood that's been on the surface for days. The good news? There's a vaccine that is protective. If you're not sure you've had it, check with your healthcare unit. It's one of the best ways to protect yourself. Hepatitis C also targets the liver. There's no vaccine for it yet, but it can be managed with modern medication. It usually spreads from shared needles and razors or tattoo equipment, not casual contact. And then there's HIV, the virus that weakens your immune system. It spreads through blood or sexual contact. There is no cure, but with treatment, people with HIV can live long, healthy lives. The bottom line is you can't tell if someone has one of these viruses just by looking at them. That's why we treat all blood or bodily fluids like they could be infectious. These germs can get into your system through a cut, through your eyes, nose, or mouth, or if you get poked by a used needle or sharp object. That's why using personal protective equipment and following the right steps aren't just rules. They're your best protection. Your role as a porter comes with a high risk for exposure. Cleaning up blood or bodily fluid spills, handling dirty laundry, or emptying sharps containers. The risk goes up if people don't throw away sharps properly or if there's use of homemade weapons or tattoo needles. In some cases, overcrowded conditions and limited cleaning resources create higher infection risks, particularly when PPE or personal protective equipment is not worn or used correctly. That's why following protocol isn't just about compliance. It's about keeping yourself healthy and being safe. First, universal precautions means treating all blood and bodily fluids as if they're contagious. Always assume infection is possible, even if it looks harmless. Next, personal protective equipment or PPE. Gloves are a must. Use goggles or face shields if there's any chance of splashing. For bigger spills, wear gowns or plastic aprons. Seal and label biohazard bags before moving them. Avoid touching your face while working and always wash your hands after. Finally, environmental control means keeping housing units and shared spaces clean and making sure vaccinations are up to date. If a spill happens, don't panic. Just follow these steps. First, isolate the area so others don't walk through it. Then, put on your PPE gloves, face protection, and gown if necessary. Use disposable towels to wipe up the visible material, and apply an EPA or Environmental Protection Agency approved disinfectant, letting it sit for the contact time presented on the spill kit. Throw away all used materials in labeled biohazard bags, and don't forget to wash your hands thoroughly when you're done. So what if exposure happens? The key is to act fast. If your skin is exposed, wash with soap and warm water for at least 15 minutes. If it's your eyes or mouth, flush with clean water or saline for 15 minutes as well. Then, tell your supervisor immediately, no exceptions. You'll fill out an exposure report and get checked by medical staff. Testing can start right away, and post-exposure prophylaxis is available for HIV in the form of medications. Every small step you take using PPE, cleaning properly, and reporting exposures makes a real difference. Everyone has a part to play in infection control. As porters, you're on the front line. You make sure PPE is worn correctly, spills are cleaned safely, and any exposure or safety issue is reported promptly. Your work is what keeps infection control effective every day. At the end of the day, this is about protecting you, your fellow porters, and everyone who lives or works here. When you use PPE, follow the best steps, and report incidents right away, you're helping stop the spread of infection. And that makes the entire facility and our community safer. When you take these precautions, you're not just following the rules, you're protecting lives, including your own. If you have any questions or concerns, please speak to your healthcare unit. Thanks for being a part of the team that makes the facility safer for everyone. And stay tuned for more from the Health Matters series brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. We've got more great trainings ahead. Thank you.